physician at Stanford Children's Health, Dr. Alok Patel, also one of our contributors. So, Dr. Patel, we heard Dr. Fauci say just recently that the booster shots raise the level of protection. But as we heard in Stephanie's piece just there, one of the cases in Minnesota, that 30-year-old man who attended that anime convention in New York City, is fully vaccinated and received a booster. So, bottom line, do booster shots protect us from these new variants?
Good morning, Kira. And we still have enough evidence, if not anecdotal, but based on previous science, to suggest that boosters still work. Remember, this one person who went to the convention, he tested positive, had mild symptoms. Could it have been worse if he wasn't boosted? It's possible. Also, we have to think about the thousands of other people who may have come in contact, who were boosted, who aren't being reported right now because they're either asymptomatic or they have not gotten tested positive. So it's really hard to make these widespread speculations just based off one case. We still have enough evidence to tell people to go out and get boosted.
Right. Okay. And it's still unclear if the Omicron variant will be any more severe, because a lot of scientists are coming forward saying although it's more infectious, it looks less likely to lead to severe symptoms, as you just mentioned, and also hospitalizations. And now Mayor de Blasio there in New York just announced this vaccine mandate for all private employers to combat the spread. So, how should leaders across the country, you think, react as these new variants continue to emerge?
Well, I think, we have to look at this in two different parts right now. So the first thing is that leaders need to be not only protecting people, protecting their communities, but we're also trying to prevent another surge in hospitalizations in an already strained healthcare system, which, even mild to moderate cases can do that, especially if people are missing work, they have to go to doctor's offices and so forth. But Kira, here's what's kind of counterintuitive. It is not advantageous for the virus to be more virulent or kill more people, to put it bluntly. The virus wants to be more contagious because it wants to outcompete Delta, the Omicron variant. But if people are getting really sick and they're not spreading it, the virus doesn't want that scenario. And so, the way to think about this is that what the virus wants to do to be able to kind of propagate and survive is infect a lot of people, but kind of tone it down a little bit so that more people can pass it on, if that makes any sense. So right now, the early data is encouraging, but we need to see more.
Right. And what's your opinion on the effectiveness of these travel bans? There's been some outcry over the U.S. ban on certain African countries in response to this variant, including bans on some southern African countries where the variant has yet to even be detected.
I and my colleagues are a little confused about the travel bans, because if you look at the amount of cases in South Africa and those surrounding countries, they're not astronomically higher than what we're seeing in the European Union. And there's no travel ban in effect in Europe. So when posed with this question of where is the evidence behind a travel ban, all we keep hearing from the White House and coronavirus task force is we're waiting to reevaluate them. We're waiting to see what the data shows. But that doesn't sit well with a lot of people, because we want to exactly see, why is this travel ban in effect and a good thing, and why is it not travel apartheid, which is what the World Health Organization called it. So I think it would build a lot more trust if we were transparent about why these travel bans are in effect to begin with.
All right, if you don't mind switching gears just a bit quickly, this new study by researchers at the Cleveland Clinic reporting that blood pressure spikes in adults during this pandemic, even more so in women than in men. Why are we seeing this increase, and what should people know about treatment and screening?
Well, Kira, I would never mind talking about preventative health, because that is what this boils down to. So this study actually showed a small increase in blood pressure. If you look at the beginning of the pandemic in spring 2020 versus 2019, the important things to look at is there's a lot of factors that can raise blood pressure. Things like a sedentary lifestyle, stress, poor diet, alcohol, smoking, a lot of things which may have increased in certain populations in the United States during the pandemic. But also we have to consider blood pressure wasn't well controlled going into the pandemic. So you give people a barrier of access to healthcare, less preventative health services, and those blood pressure numbers are going to go up. And hypertension, defined as 130/80, can be a risk factor for a lot of diseases: kidney disease, heart disease, stroke, and so forth. So I'm hoping this is a little bit of a wake-up call for people to not only get into healthcare, but for people to be better about screening and lifestyle changes where needed.
Yeah, very good advice. And bring on the meditation. Dr. Patel, always good to see you.
Kira, thank you. Good to see you.
You've helped us all find our center on this Monday.
That's
all
what
right.
we're doing.
Well, that's right. Absolutely. Every time we talk. Thanks, Doc.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.